strumming, what we're going to do with strumming is you use this technique for your long strapping muscles. So your lumbar paraspinals it's great for. You can use it on your upper traps. It's really good. And all I'm going to do is you think of a guitar string, okay, and strumming on that guitar string. But the difference and I'm going to use kind of my fingers like this, okay, and I come straight down like this and strum right over that muscle, belly. Now, what I am not doing is strumming on and on, like that, Eric. Doesn't that hurt? He doesn't care. He's just happy somebody's doing a massage for him. I do not do this. I don't go on it and off it. That's irritating, especially to a muscle that's not normal. I stay right on the tissue, get some good force in it, and then strum. What?
Can you show it on the other side just really quick?
What do you mean you can't see through me?
We're trying.
Oh. All right, we're going to show the J stroke, okay? A J stroke is, let's say right here where I found that increased density on Eric, okay? And I want to try to deform just that one region. Is exactly that. I'm making a J with my mobilizing hand, okay? So what I need to do is I need to anchor the skin above it. I anchor the skin above it. I use the two-finger approach again, and I come down, and then my hook is my release. Okay? So I come down, and I hook and release. But so you see how if I anchor up here and then pull down and release, I'm getting that deformation, and that hook just then releases the pressure off the tissue. Make sense? Down and release. Now a C stroke is the same thing again. All it is deforming the tissue, not so much in a longitudinal fashion, but more in kind of a three-dimensional type of fashion. Again, I anchor the skin above, and I start with my fingers, and I come and I just make a C. But I don't release it, and I just come up. Down and up. Now, for here, the J stroke would be your better stroke for your strapping muscles. That C stroke would be better for like rhomboids, quadratus lumborum, even your quads, kind of bigger muscles. Okay? But all that is just you're making the letter. Okay? But you've got to anchor. You anchor up and come down and make the hook of the J. Okay? You anchor up on top, you come down and make the C. I can anchor here and make a C.
For the letters that would like a reason, can't you say like an M? Does it matter?
Can I do shut that off? He has a little tiny trigger point right here. If I press on that, does that hurt? Okay, so she's getting some referred pain. Okay, does it hurt up through there just at rest? No. So is that an active trigger point or a latent trigger point? Latent. Okay. I can treat this either by stripping, so to speak, okay, or compression, okay? Let me show compression first, just because once I get the lotion on. With compression, you do not use lotion, okay? You are going to find the center of that trigger point, okay? And you can either put the muscle in a neutral position, or sometimes you can put it on stretch, okay? Sometimes if you have it on stretch, it's too much for the patient, okay? I'll come in here, and all I'm going to do is apply compression. And I will do it with my dummy fingers, okay? And I come right down in the middle of that trigger point, and I often reinforce with my other hand and come straight down. You hold for at least 45 seconds. Long time, okay? 45 seconds you hold, okay? And then you're going to release after 45 seconds, and then you're going to stretch them. Okay? Compression for 45 seconds, okay? Let it relax, take your pressure off, stretch them, okay? Elongate that tissue, and you're going to have to repeat that 3 to 5 times probably to kind of get it to shut off that trigger point. Again, we're providing an anoxic state to the muscle by adding the compression. Okay? Stripping is not what they do downtown. Well, it is what they do downtown Springfield, but we're going to strip the muscle that the trigger point is in. Okay? So again, what you do what we do is you do add lotion.
Sure.
Thank you. Okay? So we do add lotion, and I'm going to go from the origin down into the insertion, but I'm going to try to go right specific over that trigger point with my knuckles. I can reinforce my knuckles if I have to, okay, or I can come straight down, so I'll show both of them. I get right on there. If I have to stabilize her head, I can, and I'll come straight down, right over that. They go parallel to the muscle fibers and come straight down. You see how I bounced over that? That's a trigger point down there, too. Okay? So again, my force is a large amount of force to get through the whole muscle, and I go parallel to the tissue fiber, and I strip right down that muscle. It is not as comfortable, I don't think, especially if you've got a highly irritable trigger point, as the compression. At the compression, eventually you get numb. Okay? The stripping, you are pretty much holding it, and I'm putting a lot of force, and I bounce kind of over it. Okay? And what I'm trying to do is just elongate, right there, that trigger point, okay, and deform it in a longitudinal fashion. Okay, so I got to keep doing that, and that sometimes can be irritating. Sometimes feel kind of good, too. Feel okay? I can, if I want to, come if I have to, and reinforce either my knuckles or my wrist. And hold her that way. That's called strip. Action. All right, so we're going to show suboccipital release, okay? When you do this is again for the suboccipital muscles. They're very, very small but very, very dense muscles, okay? You need to create almost like a ledge, okay? So you're going to hold your fingers like this. And that suboccipital region, okay, right below the occiput, you're going to go right into the muscle, falls right on your fingertips, okay? So this side will go on her left side, this side will go on her right side, and it basically creates a shelf for her. Now, the key with this is you're going to be doing this for up to, 5 to 15 minutes sometimes, okay? Can you go a little bit towards your feet? What I want to see you guys do is your arms should be supported on the table. If you get the person's head up here and your hands are hanging off, you're going to get so tired, okay, because you got to hold your arms up and their head up with your hands. Let the table do it, okay? So I'm resting my forearms on the table. I find her occiput and I come right below it, right into her suboccipital muscles, okay? And I hang. All I do, okay, is I stay here, okay, and it's going to take a minute to 2 minutes at least, and what I'll start feeling is like a pulsating in my fingertips, okay, and that's having blood kind of trying to rush to that area, okay, and it's going to relax the muscles, the suboccipital muscles, and eventually that musculature is going to give. You just probably tractioned yourself a little bit, and it's going to give, okay. Now, when it gives, myofascial people kind of sometimes think that that's enough that's going to add traction, okay, because the soft tissue is given, okay. What I do, okay, just because a little bit more orthopedically, once I feel kind of that pulsing in my fingertips and I feel the soft tissue kind of relaxing and giving, okay, increasing its extensibility, I will provide a slight traction force. So all I do is I don't pull with my hands, I lean back. You feel that? Okay, and I lean back. Now, you can vary it. I can either lean back a lot, okay, or I can just lean back slightly. And nothing's coming from my arms, really. It's my body that's pulling, okay, and getting my fingers. Here's the deal. Your fingers will get very, very tired and numb, okay? Your fingers are also getting that compression on it, okay? It's a fantastic technique. I usually shut off the lights, and I stop talking, which is difficult for me to do, right? But I stop talking because what happens if I start talking to her, okay, she's going to talk back at me. And when she talks back, if you guys talk and feel your suboccipital muscles, they're contracting because your head's going up and down and agreeing, or she's nodding, and all that. She's not relaxing. She needs to be completely relaxed. And we just hang. That's it. So you can shut that off.